My name is Ada Skiles, and I'm the Associate Director of Chapin Hall at the University of Chicago. On behalf of Chapin Hall and the Urban Institute, I would like to welcome you to this final program in our 2009-2010 series of our Thursday's Child Public Policy Program. We would like to thank those of you who have joined us in person today, and also our listening audience for taking the time to be with us. Today's program is entitled From Data to Decisions: What is Needed for Planning Public Services? I know you will find today's conversation both lively and informative. Moderating our panel of experts on this topic is Chapin Hall's Executive Director, Matt Stagner. Again, thank you very much for participating in today's program, and I'll now turn the program to Matt, who will introduce our panel to you.
Thank you, Ada. Again, I'm Matt Stagner, Executive Director of Chapin Hall, and I'm very pleased to be moderating this last of our series for this year of the Thursday's Child events. Today's topic is about data and services. Many children and families receive multiple services. We've lately been able to develop data resources to really understand those services, and we've been working with state and local private and public agencies to make the most of that. So we're very pleased to have a panel that can address this both from the research side and, importantly, from the policy and practice side. I'm going to briefly introduce our panel and then give each of them about 10 minutes to talk about their perspective on this issue. Then we'll open the floor to questions. We also have a web audience, and we've taken in a few questions from people on the web. They may send in a few others as well. Our first speaker is Nancy Lavine from the Urban Institute, where she directs the Justice Policy Center. We're very pleased to have her in from Washington today. Our second speaker is Bob Gerga, a senior research fellow at Chapin Hall. Our third speaker is Tom Finnegan, who is the executive director of Kaleidoscope, which is a long-standing child welfare agency in Illinois. And our final speaker is the director of the Department of Children and Family Services for the state of Illinois, Erwin McEwen. So with that, I'll turn it over to Nancy to kick us off, and look forward to a lively conversation and questions following.
Thank you, Matt. It's a pleasure to be here, even if it is a rather gloomy day. It's a beautiful room and a very good turnout, so thank you all for coming. I believe we're all here because we embrace the concept that decisions and policies should be guided by facts, by data, and by empirical evidence, rather than through opinions, beliefs, or, God forbid, politics, right? So I'm going to begin this talk by perhaps preaching to the choir or stating the obvious, that data-driven decisions are sounder and much more likely to yield the desired effects than are decisions that aren't guided by data. What's more, access to data can empower communities to have a greater voice in local policy decisions. The Urban Institute has been working with the National Neighborhood Indicators Partnership, NNIP, for well over a decade now. We have 35 jurisdictions across the country who are working to demonstrate how data can inform local policies and practices. They look at policies and practices related to housing, to healthcare, to education, and other measures of community well-being. And we've also spun off of NNIP, the Reentry Mapping Network, and this is my area of expertise, looking at prisoners leaving prison and returning to communities, working with 15 sites to collect and analyze data about the locations to which released prisoners return and how that relates to their needs and the services that are available in the community. But all this sounds easier than it is collecting and analyzing and mapping data. I think simply encouraging people to do that doesn't really yield better decisions. And with most concepts, the devil's in the details, or perhaps more aptly put, the devil's in the data and the quality of the data. There's all different kinds of data out there. It can be aggregated at different geographic units. It's got various levels of quality and timeliness. In some, not all data are created equal. And it takes good and relevant and timely data to make informed decisions. When these data are available, they can be really useful in creating a sort of collective knowledge of an area or a phenomenon. They can help identify overlapping services in populations so that we can better serve those populations. And they can also aid in the identification of situations in which services and the populations they're trying to reach aren't well connected. It's called a spatial mismatch. But enough about talking about this in the abstract. I think I'm going to now turn and draw upon some examples that come from the field that I know best, looking specifically at criminal justice policy and practice. So this concept of collective knowledge, local data analysis and the mapping of that data at the local level can help provide this collective knowledge of an area that can shed new light on what's can be conventional wisdom. And thinking on this concept, I recall many years ago when I was working at the Department of Justice trying to promote the use of computerized crime mapping by local law enforcement. At the time, not a lot of agencies were doing that. And my counterpart in the UK was struggling with the same issue I was. So we'd go out to law enforcement agencies and say, you should be collecting and mapping this data. It can help, guide what you're doing. You can identify hotspots of crime. You can figure out what the relationships are between crime and other phenomenon. You can better serve the community. And the officers would sort of say, we don't need all this fancy computerized mapping. We are experts on our beat. We know where the hotspots of crime are. And so this fellow in the UK, Spencer Cheney, decided to actually study this. And so he had officers fill out a survey where they actually drew on a map where they thought the hotspots of auto theft were. And then he mapped it using real data. And there was nowhere near a one-for-one correlation. Now, does this mean that officers aren't experts on their beats? No, not at all. They're definitely experts on their beats in that specific geographic location at that specific time of day and time of the week that they tend to operate their shifts. But bringing all that information together creates a collective knowledge that can tell you different things that you might not already know. Let's turn to another example, and that's the citing of services. In the criminal justice realm, one of the greatest challenges in meeting the needs of convicted felons is the fact that there's not enough substance abuse treatment to go around. We know that people leaving prison, 2/3 of them have histories of substance abuse, and this relates to subsequent criminal offending, ability to get and maintain a job, and so forth. But when planners are looking to cite new substance abuse treatment centers, they quickly run into NIMBY issues, not in my backyard, right? So how can data and mapping help overcome these issues? Well, perhaps this is overly simplistic, but we found in working with some planners that it's very helpful to get into the community early and to map the locations, the residents of released prisoners that currently exist. And more often than not, what we see is that they're already in these neighborhoods. They're already living side by side with the people who were saying, not in my backyard. So then you present them with a choice, and the choice is, which would you rather? Having these people as neighbors because they are your neighbors, but they're going untreated, or having them treated in a facility where there's some level of control and surveillance and also support to help them overcome their addictions. There's also the issue of coordinating service delivery. And looking at the issue of prisoner reentry, we know that these criminal justice populations aren't agency specific. I mean, some people think they are. I mean, you think about, these are probationers and they're parolees, therefore they're under the umbrella of those specific agencies. But more often than not, they come into contact with many, many other social service agencies. And these connections become even more pronounced when you look not just at individuals, but at households or families in which these folks are embedded, and the overlapping contact with multiple system providers. One map that I like to show when I'm doing PowerPoints is one that Eric Cadora, who's the president of the Justice Mapping Center, prepared several years ago. It's of Brooklyn, and it shows city blocks, and there's two maps side by side actually. And one shows the concentrations of the residences of people who are currently incarcerated in state prison, and then side by side is one that shows the concentrations of families or households that are TANF recipients. And the overlap is stunning. It's almost a one-for-one correlation. And I think that has real meaning for service providers. It speaks to the value of sharing information on caseloads and coordinating the delivery of services in a way that I don't think happens nearly enough. We also worked with Allegheny County Department of Human Services, where they have wonderful data systems, and they've also reached out beyond their data on their existing clients to draw in data from the Allegheny County Jail to try to identify those overlaps between their clients and the criminal justice clients. One of the things they looked at in particular were the children of the incarcerated. So they're able to analyze foster care experience of children of incarcerated mothers and the timing of the mother's jail bookings in relation to foster care placement. They found that the number of children in foster care whose mothers had a history of incarceration has been increasing over time. And they also found that those children were more likely to be permanently placed. But what's interesting to note is they also learned that these children were no more likely to be caught up in the juvenile justice system compared to their counterparts whose moms were not incarcerated. So again, linking data across systems can tell us things that we may not already know and help guide service delivery. Finally, the issue of spatial mismatch, this idea of having services in one place and the people who are supposed to be receiving these services in another place. Several years ago, we mapped the locations of people leaving Illinois prisons and returning to Chicago. We found the obvious concentrations in the neighborhoods you would expect, but in addition to mapping their residences, we also looked at the location of services that explicitly said that they serve criminal justice populations. And it was very interesting to note that there wasn't much of an overlap at all. In fact, one of the high-return communities had not one service that was in that area. Now, this is Chicago, and transportation networks are good, but I think it still raises important issues of getting services to the people that you intend to get them to. How am I doing on time?
1 minute.
I have 1 minute and a lot of lessons learned that I don't think I can cover in that time, but I want to get them on the table. One is, and we can talk about it later during discussion time, the importance of not just looking at data, but looking at it at the lowest possible geographic unit of analysis that you can, or else you're going to miss patterns in relationships. Another is the concept of garbage in and garbage out. It's all well and good to be analyzing data, but make sure the quality is good. And there's a lot of ways that I think you can improve that quality through making the data and the information useful to the people who are providing it. The more that you can underscore that the analysis and mapping of this data can help inform their jobs and help them do their jobs better, the more they'll be inclined to make sure the data is of a good quality. And I will leave it as that. Thank you very much.
Thank you, Nancy. So now we'll turn to Bob Gerga.
I want to concentrate on a few themes in my comments this morning. One is how what we do in the human services has become more data-driven. Issues such as Nancy just mentioned about cross-sector issues, about the need for need and use of local-level data, where we might get better data, and one example of what we've done recently in Illinois. As we move more quickly into an era where decisions are data-driven, as the federal government works to improve its statistical system, and as raw data becomes more and more available, there are going to be significant challenges for all of us working in the human service sector to access that data and make it more understandable. States are struggling to put together data that speaks to how they can cut their budgets, while at the same time having the least negative impact on vulnerable populations. At the same time, both public and private agencies are being asked to achieve outcomes that cut across sectors. In Chicago, as many of you know, the schools have taken on the keeping kids safe in addition to educating them. Many pediatricians, while immunizing children, also prescribe medications to address their mental health. The child welfare system, in addition to protecting children, is now being asked to assure their educational progress. The criminal justice sector, as Nancy just said, is asked both to keep communities safe, while at the same time providing services to keep people with criminal records and help them reintegrate them into the community. Welfare agencies and public housing agencies are also being asked to improve the employability of their clients. So this is true for not only government agencies, but non-for-profit and community-based organizations who are now being asked to do everything from conducting needs assessments through collecting data on the outcomes of services for the individuals and families that they serve. The funders of their programs are asking them to do this. Unlike the need of the federal government, states, counties, and municipalities have a need for data broken down by small geographic areas. Many of the data efforts of federal agencies are focusing on national level measurement or state level measurement. So what is typically offered on federal websites, which is more and more, is at the state level and not that useful for state level decision making. So a lot of you might have seen recently the announcement for Promise Neighborhoods. And I quote, I think this offers an example of kind of the problems around developing data for decision making. And I quote from the application: "The purpose of Promise Neighborhoods is to improve significantly the educational and developmental outcomes of children in our most distressed communities and to transform those communities by supporting efforts to improve child outcomes and ensure that data on these outcomes are communicated and analyzed on an ongoing basis by leaders and members of the community." That's the first way we're going to achieve the purpose of Promise Neighborhoods. That's a tall order. Improving developmental outcomes can really span a variety of things, from making sure that kids are school ready to preventing risky behavior in adolescence. In addition, the application talks about family and community supports, integrating services to get rid of silos, and doing rigorous evaluation. The data information requirements of this program are immense. Just one aside, also relative to Promise Neighborhoods, we have underestimated the level of demographic change and mobility in our communities, in part because the census data really does a very poor job of doing this. Work done using the Annie E. Casey Foundation Making Connections survey, largely done by Urban Institute researchers in 10 cities, shows how much change there is at the local level, not just moving out of communities, but also within communities. This has tremendous implications for Promise Neighborhoods and addressing other issues at the local levels. So where do we get the data to do all this work? What can we do to address the need for better data at the state, county, city, and neighborhood levels? The workhorse, as I mentioned, that we use to do the basic planning is the census data. We all have come to rely on the decennial census data to provide data at small geographic units. Many of us know that the 2000 data is now inadequate for what we want to do now in 2010. Significant changes in Chicago make the 2000 data almost useless at this point. We look forward to having the kind of data later this year from the Census Bureau that will release data at the census tract level from the American Community Survey. However, that data is going to be aggregated over a 5-year period. So unlike the decennial census data, we won't have data at a particular point in time. It'll really be averaged over 5 years. We'll get that data every year, but every year it'll be a 5-year average. Now, the implications of this for community-level decision-making is important. You're not going to have at least one point in time every 10 years where you're going to know exactly how many children and families are in your community and what their characteristics are. It's going to be a 5-year average. So there are real limitations around what is consistently available. As we all know, survey data is rarely available, and administrative data is difficult to get a hold of. As many of you know, our workers in both public and private agencies spend lots of time collecting this data. Sometimes it scares me to think about doing an estimate of how much time is actually spent using the data, the cost of that, and how little is actually spent on using the data for good. We're lucky here in Illinois because we do have state and Chicago agencies that really promote the use of the data. The Department of Children and Family Services, the Chicago Department of Family and Support Services, and the Chicago Department of Public Health all do a lot to encourage better data use, but I think all the leadership would agree that the city and state agencies, they would agree that more is needed, more analysis of data is needed. I do think that the leadership for better data does have to come from the federal government. There are efforts from the Obama administration to improve data resources at the federal levels, but a parallel effort that has to occur that improves the ability of states to use their own data, which in many cases is hampered by federal law such as HIPAA and FERPA. States do need help in using their data to drive the type of change that the federal government is asking for in programs like Promise Neighborhoods and others. Recently, at the request of the Governor's Office in Illinois, we've done work on families that are experiencing an array of problems in government intervention. Working with 5 state agencies, we analyzed administrative data on 500,000 extended families in Illinois who were served by their state in 2007 and 2008. We found that 23% of these families used over 80% of the adult and juvenile corrections, Medicaid, and foster care funding on the entire group of 500 families. So 23% of those families used 86% of the dollars. And those funds are almost half of this entire state budget. We call these families multi-system families, and that they experience at least two of the following: foster care, mental health services, substance abuse treatment, adult or juvenile corrections. And the vast majority of these families have significant family violence issues, the vast majority. So we've also geocoded these data and found some striking statistics. There are a number of census tracts in Chicago where over 90% of the children live in multi-system families. We've also done this at the school level, and many of the schools in Chicago have a significant percentage. Some of the elementary schools have up to 70% of the children in those schools coming from multi-system families. So these children are coming from families that are at great risk. This data is now being used by city and state agencies to better understand what we need to change as we move into an era where the challenges are growing and the resources are dwindling quickly. What do we do in these communities where most of the children are living in families with multiple challenges? I don't know. But it's probably the case that we need to dig a little bit deeper and to collect different types of data to learn what services and interventions these families need. But at least we know a little bit more about where these families are, where the children go to school, and the magnitude that we're dealing with in these neighborhoods. I think the next 2 speakers are going to do a good job of putting a little bit more flesh on the skeleton and talk about kind of the real agency level issues in dealing with the data that I've been talking about.
Thanks, Bob, and thanks for noting the segue. So we'll now move from the research perspective. We're all shocked to learn that researchers love data, but the question is, how can agencies learn and love data and make the most of it? So first we're going to turn to Tom to talk about this from the private agency perspective, and then to Director McEwen to talk about this from the state agency perspective. Tom.
Thanks, Matt. I couldn't hear a thing that Bob or Nancy said, so. As I was preparing for today's comments, I did what I always do. I do a little background and look on the internet, and then I brought out the glasses so I looked as intellectual as Matt and Bob and Nancy. But I think that a couple of things. One is we do really serious work, but I don't think we can take ourselves seriously all the time. And I think the thing that struck me as I was looking at some research was you can't just believe what you're told. Go back to the source material and ask questions. And as I was perusing the internet, actually yesterday and even this morning, I came up with a couple of things that I think bear that out. And one of them was USA Today has come out with a new survey, alarming statistics, so get your pens out. Apparently 3 out of every 4 people make up 75% of the population. I know that's startling. And then there's another piece of literature out of Wayne State University, The Effect of Country Music on Suicide. Bear with me. This article assesses the link between country music and metropolitan suicide rates. Country music is hypothesized to nurture a suicidal mood through its concerns with problems common in the suicidal population, such as marital discord, alcohol abuse, and alienation from work. The results of a multiple regression analysis of 49 metropolitan areas show that the greater the airtime devoted to country music, the greater the white suicide rate. And finally, my favorite. Intermittent access to beer promotes binge-like drinking in adolescents, but not in rats. Needless to say, that research was done in Australia. A couple of things that I was thinking about with respect to data and research in particular was that, at least for me, I group data into three categories: management information, evaluation, and research. And management information is just the numbers that we look at frequently that talk about where kids live, how old they are, and various characteristics. We might look at trends in terms of where they move to. Evaluation can take on a number of shapes. One of the program evaluations that we currently do here in Illinois, we have a program with the state called Systems of Care, and Northwestern University evaluates that program using a variety of data, but one of the most significant pieces is data that they get from the CANS instrument, which is given to every kid that comes through that program, and so they can set a benchmark and see if the kid is better off for having been in that program. I think that the thing that struck me about management information is I'm actually slightly different than some of these folks in that in my 30 years, half of it's been in government and half of it's been in private agencies. My staff like to say that I'm bilingual because I do understand government. And the thing that I can tell you is that we have a long history, at least in Illinois, of using data to make decisions. I think that what has happened, at least in Illinois, over the past 15 or 20 years is that we've gotten better at using it, and I think that there's plenty of evidence to support that. One of the things that we talk a lot about in Illinois is trauma-based interventions. Well, that whole push comes out of research, and it comes out of the literature. It's not something that somebody pulled out of the sky and said, oh yeah. Now, if you talk to folks in the field, they'll say, well, of course, this is something that we've known for a long time. But I think that one of the things that's been lacking, especially in social services, is we talk about things like trauma affecting children, but historically we've not necessarily done the legwork to prove our point. And so even though we don't do enough research, and actually, as I've pointed out, and I don't mean to demean the researchers, but the fact is that we could focus on some things that are slightly more important, and I think that we could do more research and evaluation than we do. From my perspective, there are a number of challenges with respect to how private agencies interact with government. And when I talk about government, I'm talking about state government, federal government, county government, and municipalities. And some of the challenges that I think that we face, and I actually did hear bits and pieces of what Nancy and Bob did say, so some of the things I'm happy to say are both redundant but support what they're saying. And the first is that there's a significant amount of variability with respect to the data that the feds, the state, and the local municipalities use. And so when we as private agencies or community folks are looking at data, it becomes difficult sometimes to sort out what in fact they're talking about. The other thing that happens often is how do those entities interpret the data? One of the things that I read on the internet this morning, it talked about research, and it made the comment that research is shooting an arrow in the air and then moving the target underneath where the arrow has landed so that you can prove your point. And with all respect to Mac, the fact of the matter is that government is about making things happen for the public, but oftentimes they will use data to support their arguments. And I think that I'll talk a little bit about that later, but the other question is will government give me the data? One of the questions that was posted on the web had to do, I think it was North Carolina that was asking the question, and that is, how do you get a collaborative initiative going between state agencies and the academic world and private agencies to share data? Now, Illinois is fortunate. Chapin Hall has a long history of looking at data from a number of code agencies and cross-pollinating and fertilizing that data to come up with some of the things that Bob talked about, but that's not always the case. Sometimes it's difficult to pull information out of government. I can say that from my own experience, that's not the case with DCFS, but it's not always the case with the county, and I'm sure with municipalities and sometimes with the feds. The other thing that I think we struggle with is understanding what the information means. And the best example that I can give, at least in Illinois, is historically there's been a lot of focus on placement of children and the movement of placements, or the movement of children in those placements. Well, if you look at the surface with respect to placement data and you don't understand how those things are counted by the computer, you can come up with some pretty outrageous extrapolations in terms of the movements of children. But if you understand that hospital stays and other things count as placements, then it's not real good still, but it's not as bad as you might otherwise have thought. And so I think that that goes back to my earlier point, and that is that you have to ask questions when you're talking to government officials and say, well, okay, so how did you define what it is that you're talking about? I think one of the other things that we have trouble with is the way that the entity sorts the data useful to us? At the community level and at the private agency, not so much. Sometimes it really is about frequency distributions and about trends, and it doesn't necessarily reflect the data that we might use. One of the things, it's actually not in sequence, but one of the things, and I heard both Bob and Nancy mention this, one of the things that would be more helpful is that data be supplied at the smallest local community level possible. So census tracts, zip codes, Chicago community planning areas, whatever that might be. Well, the reality is that private agencies, at least, and community-based organizations and communities don't organize themselves the way that government necessarily suggests that they ought to. So, for instance, if I live at 63rd and Damon, across the street might be in a different planning area according to the data, but that's across the street to me. I'm not necessarily making a distinction between the community that either private agencies are making or government makes. And so trying to figure out what in fact that complexion is becomes sometimes difficult, and I think it's a challenge. The other thing is that with respect to how we provide services, my organization, for instance, provides services across Cook County. But the bulk of our activity is in the southern suburbs, and then we do some work on the west side, and then we have kids all over the city who are much older. And so trying to figure out what's relevant can sometimes be a challenge, which I think is another great challenge for us, and that is that there's so much information. We spent 2 full days? We spent 2 full days in this room a couple of months ago, and I was telling Nancy, we were talking before our comments, and we spent 2 days getting a data dump, and there really wasn't much time to talk about what all that meant. And so I think the great challenge, especially the smaller the agency, is how do I actually sort through all this stuff and pick what's relevant to my agency? And then I think in closing, and I do believe that I heard Bob say this, really data that's relevant to me is data that's consistent with what the government entity is using to make decisions, first of all. So don't give me a piece of paper that shows me a bunch of data and then use something else to make the decision. The second is it has to be timely. It has to be relevant in terms of what's going on in the community. And real time is a lot to ask of anybody, but there is current data. And then I think the extent to which we can get community-specific information, and we understand the assumptions that either government's making or the assumptions that we have to make with respect to using that data is critical. So,
Thanks, Tom. So we'll now turn to Director McEwen, who is also bilingual, and but today we'll be speaking state.
Thank you. Good morning. Well, whenever I'm on one of these panels, it feels like a point is growing at the top of my head as I speak. I thought about this question and the notion and the discussion around data, and at the end of the day, what we should be using data and research and information for is to provide a service to the clients, children, families that we serve that is going to improve their functioning, improve their ability to take care of themselves, take care of their families. And a lot of times we spend a lot of times reinventing the wheel. And so I'm always leery when folks come to me and we're talking about research and we have cumbersome data collection efforts. And the push for validity and rigor in research and its impact on the data. And I know the importance of it for researchers to be able to state their claim. And sometimes they regress and control for stuff that I know I'll never be able to control for in the practice arena. And so what I've been doing and how I've been using data at DCFS is to really try to help with those decisions. Now, how I got to this point was the previous director, Director Samuels, when he was here, I was very passionate about this work and what we do. And I would go in his office and pound on his desk and I'll say, Brian, but look at this and you don't understand. And he'd say, well, Mac, how many cases is that? How many kids are impacted in that way? How many families are impacted in that way? Can you quantify the impact? And I would look at him just completely puzzled, you know. But I would come away from that understanding that a lot of times what he was saying was really about one or two cases and not about what I was saying was really about one or two cases and not about the vast majority of cases. But the place where that data was at is the place where the work is being done. And so in Illinois, we've been looking at data collection, for me, in several places. First, at the service delivery level. At the service delivery level, we have integrated assessment data. Integrated assessment is our front-end assessments that we do on every family that comes into the child welfare system. Then we have CANS data, Child and Adolescents Needs and Strength data, where we are doing assessments on kids as they move to higher levels of care or psych hospitalization. And now we're beginning to do that every 6 months at ACR, so that we're not just capturing this data when a kid's in crisis, but we're starting to capture this data when a kid is at a normal range of functioning. Service planning data. You know, we have a SACWA systems. All of these service plans are entered into those systems, so we have that data and information. Then we have a duly involved youth data. On a quarterly basis, kids who are involved in both the child welfare system and the juvenile justice system, we do a record review, a service planning review to make sure that those kids are on track and moving in the system and not just languishing in juvenile care, juvenile justice system beyond their release dates. So all of those data, what's unique about them is that they're all entered into a computer. And with that technology and the technology capabilities gives us an opportunity to analyze that data in different ways. And then we got performance contracting data. We got performance contracting data is data that looks at this thing from the programmatic contract agency level, so that we can start to look at and determine how are agencies performing on these set of outcomes that we can really look at from the individual case, practice, service delivery level data. And then that data from the federal government, which we struggle with all the time, is system level data. And what does that system level data mean to our decision making? and how do we utilize that data. And so I think what's the really important thing is understanding that data and information analysis and evaluation is not just coming from the research community. It's coming from us. It's coming from the practitioners. And that's the most valuable information. It's the most current information. A lot of times it's only 6 months old. A lot of times it's a year old. And so we can look at that and understand it. It also captures the movement of people. And then we've got two other tools that we add to that data stream is our statewide provider database. And that is really about identifying and understanding where are the service providers located. And we don't just put that data in based on the headquarters of the service provider, but the location that the service is being delivered at. And that's really important because then we can start to look at and match the addresses to where our families and kids are located at. We can start to quantify what are the services that they may need, are there similar services that they need, and where are the providers who deliver those services. And if we're going to issue a new contract, we should be trying to issue those contracts where the folks are who need the service, not necessarily where the provider is located. And so we have those statewide provider database to understand, and we have geo-mapping so that we can start to address that issue of planning. So in geo-mapping, we can go in there and we can set boundaries that look at the Department of Human Services safety network boundaries. I've been having conversations with aldermen, and we can set those boundaries to look at automatic boundaries. I've had conversation with state legislators, both representatives and senators, and we can set that data to look at, we can set those boundaries to look at those districts. And more importantly, I've had meetings with community organizations who define themselves, and I can also go in that geo-mapping technology and set those boundaries so that we can look at how the community identifies themselves for planning. Now, the struggle that I get sometimes with researchers and others who want to add another layer of rigor to it is they question the data collection. You know, because the data that we're collecting is not coming from researchers and those, it's coming from caseworkers, it's coming from practitioners. And the question is, are they collecting all the data? Is this just readily available? Well, part of that solution is that what you're tying this information to is their job performance. If it's part of their performance and they understand that their work is being evaluated on this data, they do a better job at collecting it and entering it in a lot of instances. The best example I can give is we was having some issues with our child and youth investment team data, and the final arrangement was not getting entered. And at a summit that we had for all the SAID providers, the workers who worked in the SAID, child and adolescent youth investment teams, we presented that data, and it looked like they really weren't getting the job done because we really couldn't see when these kids got there to the placements, and when they got to the placements, it seemed like it took a long time. Well, within 2 weeks, 80% of the missing data was entered all of a sudden. And not only that, they keep up with it now. You know, so that when you give the practitioner this information and they understand that you're looking at this information in that way, they're more likely to enter in that. In performance contracting, the same thing happens with the agency level and at the program level, is that when program managers and administrators understand and know that the department is looking at this data to make contracting decisions, for penalties, for incentives, for those sort of things, the notion that they want that data to be right, they want that information to be correct, becomes paramount. And so in those things that when you're talking about your data collections at that level, it is actually the end user of the data who is also the collector of the data who has some investment in what it says so that they are trying to enter it into the system in the correct way. And then make that data and information available to the researchers, to make sure that the researchers have access to that data, and then ask all the questions you can ask. I ask questions all day long, and you ask it in all the different ways. And I'll tell you another thing, I ask more than one researcher because a lot of them have the same data, so I ask them the same question, see if I get the same answer, you know. And so the notion of making that data available to those researchers becomes really important. Now, to understand the real idea, though, is how do you make that data, once it entered, available to the caseworker? That's where we're at in Illinois right now. How do we make that data available to the caseworker? And so that it is involved in the case decision. And so what we're starting to do is that as workers enter their service plans, they can go back and look at the last 3 or 4 cans that was done. They can look at the ones that were done by the residential program. They can look at the one that was done by them, the last one they did as a worker. If the case changed hands, they can look at the one that was done by the previous worker. But the idea and understanding is the hope that they'll look at those cans data and start to recognize whether or not there's improvement in the overall functioning of this child or the overall functioning of this parent. And they can measure it from time, from 6-month period to 6-month period. Now, we struggle with getting them to use the can because they say that's 138 questions, you know, and it's long. And I always say, either you're going to spend that time in the front end or every 6 months doing this, or you're going to spend that time moving that target underneath the arrow and getting it wrong and not having the right information to make the right decisions about what services to apply. And then the notion of linking those identified services to the statewide provider database. So now that if you have a CANS on those children and you link it to the statewide provider database, it will tell you what are the recommended services for that particular problem that child or family may be experienced as presented by evidence-based practice in trying to resolve that problem. So this is the service that we recommend this child. And not only that, this is the closest provider of that service to that child. You know, see, because distance to service is a big barrier. And we've been able to look at that in these data systems and see that if you got a service provider that's far away, the utilization of that service provider by the person who needs it starts to diminish the further away the service is from the person who needs it. And we struggle with that because we have a system where we say we contract with this agency and they cover this area. But if they cover too larger geographical areas and don't have an office located near where the folks who need the services are at, then you have a diminished return. And so you have that ability to take a look at that thing. The other thing that you're taking a look at is if you can start to line up those changes in the functioning of the folks we're serving, then we'll get to a place when we accumulate enough of these data sets that we can look at every 6 months. And then you'll start to be able to see that provider A utilizing this services gets better outcomes than provider B utilizing the same service. So that apples and apples comparisons, you can start to say, is there some efficacy or validity to the model that this agency is using, even though they both claim to be using evidence-based practice model compared to this agency? And as you start to do those comparisons, you can start to make decisions when you cross-compare that data to performance-based contracting, and then you can make decisions about whether or not we continue to contract with this agency, not because I like the CEO or I don't like the CEO or the CEO's legislator is calling, but I can make that decision based on the fact of the quality of services being delivered to the client and the improved outcomes for the client. I also can make a decision about whether or not to say that a corrective action plan is needed so that we just don't just let the agency operate until it's just failing, but to say that here's a corrective action plan, these are the measures and adjustments that we think need to be made as we set out and talk about it. And I can also say that this is a very strong provider. I've got a group of clients in this area that needs this service that you're doing an excellent job of providing over here. Can you open an office over here and deliver that service for me in that way. So when you start to look at it in that way, then data becomes a real important tool, a very important tool. I always say that in this business, it's a lot of passion about this work from stakeholders, legislators, families, and I always say, in God I trust, all others bring data. You know, so if you can't bring the data to the table in ways that makes it useful, then we're going to continue to struggle with a lot of these issues, and we're going to continue to spend dollars and not have resolutions to the human service problems that we continue to see our communities face. And so in closing, I would say that since this is baseball season, you know, that when the player hits a home run and knock the ball out of the park, he does not score until he touches every base and touch home. And so we can have the greatest data in the world, but we will not score until we get the data into the hands of the decision makers at the case level, at the program, at the agency level, and at the system level.
Great. Thanks, Mac. So what I'd like to do now as a moderator is begin with a question of my own, then go to a question that came into us via the web audience, while those of you in the room think about questions that you might have for the panel. My first question is one that I hope ties back to the points that Nancy was making about the evolution of the criminal justice system and its use of data, and I believe she talked a bit about this notion of hotspots policing. And if she could remind us what that is, I would love to hear the other members of the panel talk about how that concept might translate into the human services concept.
Right. So when I was giving my talk earlier, I was drawing from experience of working with police departments some 15 years ago now, who were just starting to embrace the use of data in a way that could help inform decision making. And of course, that led to promoting the use of mapping as a way of identifying where the concentrations of the data of interest to police were, and that, of course, is the concentrations of reported crimes and calls for service. And you know, since then, of course, this has become commonplace among law enforcement to regularly, routinely map and analyze the concentrations of crime and you know, help inform not just where to be positioned to respond to crimes or prevent them in the first place, but also to understand what relationships crime might have with other community factors in order to collaborate more with the community and engage in more problem-solving kinds of crime prevention efforts. And why is this relevant for this group? I mean, you're not here because you're policing people, right? But I think that there are some lessons learned there because early on, there was a lot of resistance. Why should we do this? Why does this make a difference in the work that we do? And once we were able to demonstrate that it did help guide their work, the data improved, we got the folks on board, and it opened up a lot more possibilities both for practitioners and for researchers.
So do other members of the panel, if you translated that sort of crime mapping to needs mapping among families, I think it relates to some of the issues Tom and Director McEwen were talking about around the appropriate geographic boundaries for understanding the data, but there may be other translations.
Thanks, Mac. Well, let me finish laughing. I'll talk. Well, I think it's identical to what Mac was talking about in terms of what the department is doing, and I think that what's clear is, if you tie it back to my comments, if you go back 10 years ago, we looked at zip codes, and we looked at least within the state system, we looked at the placement of children relative to not so much private agencies, but the local area DCFS office. And now we can look at a far finer level of detail in terms of where children and families are, and I think perhaps most importantly, where they're moving to, because what we do know is that our children and their families do move around a lot. And so we can see the trends in terms of where they're moving. And I think the other thing, which is really probably one of the greater challenges that the director has, is that really services need to be where children and families are, not where my office is and where it's comfortable for me. And to have those discussions and to push private agencies or community organizations to really have a data-driven discussion can sometimes be difficult, because really we are passion-driven, we're mission-driven in our organizations, and we don't necessarily agree all the time with respect to what information is being presented to us. But the fact of the matter is that there really does need to be a disproportionate amount of services where those service needs are, and those decisions are, in fact, probably best driven by data.
When I think of the notion of hotspots, I had a vision of our differential response maps. Differential response is a new initiative that we have legislation that allow us to do family assessments on lower risk families as opposed to investigations to try to get to those underlying things to address that risk. But when we looked at those maps, what we saw was communities that had 50 of these cases per square mile. And if we look at that's about 20% at the lowest level risk. So if you assume an equal distribution, then we was doing 250 investigations or more per square mile in certain areas all over the state. So as we mapped those areas, we were able to see concentrations of DCFS investigations. And not looking at indicated reports and not looking at the kids who come in care, but just looking at the areas where somebody is picking up the phone and saying a child is in trouble. And so we kind of looked at those as hot spots, and we started to do things that we thought to have a greater impact. Because when we looked at those communities, I have one particular community in mind where we were doing 3,000 and 4,000 investigations a year, but we only had 120 kids in foster care in that community. And those 120 kids accumulated over a number of years and didn't get there in a single year. But we were doing 3,000 to 4,000 investigations every year and have been doing that for the last 10 years. And so the understanding and looking at those investigations in that area as a hot spot and saying that then what other things can DCFS do? So we started to do a partnership with school districts, introducing strengthening families and protective factors into those communities, trying to establish family advocacy centers with community agencies that were already existing in those communities, so that we can have a greater impact on families other than just foster care. You know, so the notion of hotspots. And then when we overlaid those maps with community violence maps and other different trouble and human service problem areas, you can start to see overlays in those maps and understand that some of the issues is how do you look at community as a milieu, and then how do you start to change the community milieu to promote healthy families and healthy children.
Bob, did you want to speak to that?
Quickly, there's a real distinction across sectors in how mobile workers are. You know, when you have a home visiting program or where you can move police to a particular community where there's a hot spot or where workers are going to families, it's somewhat easier to mobilize that than when you're thinking about bricks and mortar. So in Chicago, it takes 5 years to build a new school. You know, by the time they know there's enough kids in a particular community, you know, they're already 5 years behind in building a new school. So when you need, or child care centers, another example. It's different now, but a few years ago when property values were very high in some of the northwest side, southwest side communities, agencies couldn't rent places to build child care centers, even though there was a great need in those communities for child care. So it varies tremendously across different sectors, whether or not you're kind of place-based or whether or not you can be more mobile and provide services where the families are.
Let me turn to a question that came in prior to the panel from the web. I'm going to paraphrase it. The question is, how can we use data to get states to move treatment dollars to more widespread prevention, particularly for birth age 0 to 5? So I don't know if our policy and practitioner folks have examples of how the types of data we're talking about might tie into making that argument when you I think there's often, again, a passion around prevention, but how do you use data to actually get the state or whoever the funder is to shift those dollars?
I think that without repeating some of the things that Matt talked about, certainly the transition in Illinois is one in which we've begun to use data to make more rational decisions with respect to where we provide programs and how we develop them. And I think that again, some of the data that we've used with the child and adolescent needs assessment, the CANS, we talk in so many acronyms I forget what they mean. But I think that, and the same with the trauma initiative, the training that DCFS does with respect to all of its staff right now is trauma focused. And I think that again, at least in Illinois, there are plenty of examples of doing that. To me, it's about leadership and will. If somebody's not inclined to do that and there isn't a spirit of collaboration, which I think on most days we have in Illinois, then it's not going to happen. So it really is about the vision that leadership has and their willingness to pursue those sorts of activities, because they're not always easy decisions.
And then I would probably just add to that the notion of shifting the need. You know, so when you're talking about shifting dollars from one area to another, does that mean that you're going to leave that need uncovered in the area you shifted from? And so I think one of the most important things to do is that address those need areas and reduce that need. So I guess the best example I can look at is foster care in Illinois and reducing the number of kids in care from 53,000 down to 15,000. And then instead of talking about shifting dollars, talk about reinvesting dollars, so that if you can adequately address the needs of that population that's at that high-end acute problem area and reduce the need of those kids and families, then can you retain the dollars in the system and reinvest those dollars back to your front door to do the prevention work that you need to do? And so I think the first thing that if you're going to try to do that, you have to get a handle on that acute need first before you can address the prevention areas. And the notion of shifting dollars is a difficult notion. The other area is to start to understand what I call institutional or system entrepreneurship, is the notion that it becomes important for the system to grow dollars. If you're talking about shifting one pool of dollars from one population to another population, that means we're afraid to have the discussion of spending more dollars, and the discussion is already limited to spending the same dollars. And so the notion has to be then, how do you increase revenue? And not just talking about a tax increase or anything like that, but talk about it in terms of federal claiming, in terms of what resources does the system have that they can actually sell out or reap revenues for their expertise in those areas. How do you start to get better utilization of the resources you have, using data, looking at those improved outcomes, because it's a lot more expensive to operate a broken system than it is to operate a system that functions and get results. And so you got to start to have that discussion also of expanding resources to cover both populations.
Great. Nancy?
Yeah. This is a really hot topic in the justice community right now, and Mac, you used the term reinvestment. There's something called the Justice Reinvestment Act that's pending before Congress, and it looks like it holds promise for passing, and in anticipation of that, there's actually federal dollars that will be on the street shortly to support this concept, and it's exactly what you described. In the justice world, I think it really applies to everything we're talking about, because when you look at the share of both state and local government budgets that are dedicated towards the criminal justice population, it's gigantic, and there's real opportunity costs there. You know, the money could be used in other ways that could be more prevention-oriented and dedicated to helping prevent people from entering the criminal justice system in the first place. So these efforts are intended to look at who really needs to be behind bars, which is where the most of the expense is going. And, you know, saving that space for people who scare us, not people who we're mad at. And finding other things to do for those folks that are more prevention-oriented. So it is shifting resources, but it's not taking away from one and putting the other. It's finding more cost-effective ways of using the scarce resources you have.
This issue is also the dominant issue on use of Medicaid dollars. You know, the vast majority of our Medicaid dollars are going to long-term care, institutional care. And people say, oh yeah, it's federal dollars, but we're you know, general revenue is paying half of those dollars, and if you only have a limited number of general revenue and you need to support people in long-term care and in psychiatric care and other hospitalization, you won't have that money to point to services, more prevention-oriented services, community-based services using those Medicaid dollars.
Let's turn to the audience in the room. If you have a question, please raise your hand. Someone will come to you with a microphone. And if you could just tell us briefly your name and institutional affiliation before you ask your question. So I think Ann is back there. We'll just start with the woman just to your left.
Hello, Dr. Sandra Thomas, Chicago Department of Public Health. And I wanted to throw back a little challenge to you that I think that data are often talked about in abstract, but they exist in context and they require resources to produce and manage and analyze. And I think that we never discuss data in those contexts, that what percentage of a budget, if you're spending less than 0.5% of your budget on data management or data analysis, that there are realistic limits about, you know, if you want better vital statistics data, but no one wants to pay $50 for a birth certificate. So I think that those are the types of things that we need to develop better models about economic models and systems models about what do different models of data collection cost and about the investment that's required. And another thing that I get somewhat concerned with is that there is about the discipline about what are the unanswered systems questions about what are different alternatives for models of how we work better with the resources we have, but also what are realistically resources to get to the next level. But it has to be very disciplined. For example, in terms of people getting very focused on small area level data or micro data, it's not always helpful. For example, if you are trying to train to be an elite athlete, being closely monitored and having data about each of your performance sessions is going to help you get better. But if you're trying to lose weight, monitoring your weight 5 times a day versus 1 time a day versus once a week, monitoring your weight more is actually going to not help you. I think that people get so focused on micro-level data that they could be making changes due to random variation. So I think that being honest with people about when is small area data going to help and when isn't it, and I think that for people being told less is more, that it's not just more, and smaller, but really having knowledge and understanding and having people who know and understand, not just more data.
Great. So really, I think 2 questions there, and we had a little bit of a hard time hearing up here, so I'll attempt to restate them and reframe them. One is how to think about that data investment, given that data are often not a large percentage of your budget, but how can you make the best investment in that? And then to slightly restate the second question is, one of the problems with small area analyses is things bounce around a lot. So if you're there monitoring every day, 1 or 2 of the rare incidences might lead you to overreact to something going on in that small area. So how do you think about what area is big enough, how often you should monitor? Tom, do you want to take a first step at that?
What we do at Kaleidoscope is we only count the things that we need to count. So we stripped away a lot of what I call collateral noise with respect to data that we were collecting, and we really
didn't necessarily use it, and it really provided no value added to the decisions that we made. And so we looked at all of the contracts that we held, we looked at obligations that we had to the state and the county, and we identified specific variables that we were going to count and track. And we do that, and at significant savings. I think the other thing that it did in the agency was that it provided a clarity that we historically hadn't had, because there was so much stuff in terms of what we were counting, and what I like to say is we count lots of things that suggest to us that things are going really, really well or really, really poorly, but we really don't know. And so now we count the things that do make a difference, and it has.
Nancy, did you want to speak to those from the...
The micro-level analysis issue, I think, is a really, really good point. Thanks for raising it. Two issues come to mind. One is, as much as I'm always saying, look at it in the smallest geographic unit possible, there are issues of data confidentiality. We don't want to risk identifying people who are often vulnerable populations. So that's one thing to consider when going to very small geographic units. The other response is that we do look at rare events in my world, and probably, well, we hope they're rare. Things like homicides, where if you're looking at small areas, you hope there's not many. And then how do you discern patterns? And typically we aggregate across time in order to do that, and that enables us to still identify patterns and trends.
Let's go to another question up here in the front. If you could wait for the microphone, and then please identify yourself.
I'm Nancy Ronquillo, serve as CEO for Children's Home in Ada, and I also serve as chair for the Illinois Partners for Human Service. So I want to make a comment and then a question. My comment is I was really very gratified to hear a cross-sector look, a cross-sector thinking about human services and our impact and needs, because our human beings, families, kids don't come in little silos of need. And so I think our sector and the community providers and our public sector partners and researchers have to think about that and design it into any research that's being done. And I think we have a challenge in the sector to figure out how to take collaboration to a different kind of synthesis and be more effective there, because in many ways collaboration can be an inefficient way to do things against many a broad set of needs. So thank you for the cross-sector view. The question I have for the panel is, there was a part of me that was saying, this would be very, very good to hear if we were in the year 2005. But we're in the year 2010, and we know what's happening in Springfield, or not happening in Springfield, is close to disaster in terms of human services funding. Very, very close to disaster. And data, where is data in that decision making in terms of the halls of our elected officials? And I think I'd like to hear your thoughts on how we can drive the data to ensure that we do not see the catastrophic destruction of what fabric of care there is for communities across a broad sector of need and results. Because I do think that nonprofits and researchers have been partners trying to drive toward outcome-based, evidence-based, and when we put on our advocacy hat, we come to a place that it doesn't matter a whole lot because there just isn't enough money. And so that's my, I know we have Representative Flowers here to, maybe, you want to build on that?
That's a tough one. I'm going to, I don't know if Bob would want to just say a word about work with the governor's office a little bit more to identify these multi-system families and restate that statistic, which I think is definitely related to the better use of existing resources or the ways to do better with less if we have to.
Yeah, just a second. We have a brief on our website called Illinois Families and Their Use of Multiple Service Systems, for those of you who didn't pick one up or in the air. If the issue in Springfield wasn't completely a political one, then I would have a different answer. what data can speak to this crisis right now is difficult. We can, start looking at what happens after, if we do have a catastrophic drop. That's one concern. But the fact is that, there's an efficiency issue also, I think, that speaks to this. When we talk about, in our study here, we analyzed $60 billion of services over a 15-year period. Where did we get out of those dollars? I don't think we know. We maintained people in their status. We protected some people. We gave them health care. But did things get better for those families? Did we do something better for those families? We may have, but we actually don't know. So in 2005, we should have started to do evaluations of our programs. So when we have some, actually DCFS does, I think, more than any other agency relative to evaluations, but we don't have others in some of the really big ticket programs in the state. And if we had that information about what works and what doesn't work and who gets better and who doesn't get better when they get a particular service, we could talk a little bit more about rational budget cuts at this point instead of just using the axe instead of the scalpel. Is that right? Right. So,
Director McEwen?
Wow. I think that what we're in the process of doing in Illinois right now and all across the country is dismantling the human service system. And in dismantling that system, we have an increasing need in these vulnerable populations. So Bob was talking about these families, but he's talking about families who are accessing the public system. What we don't have is the level of families who are accessing the private system, meaning that they're using their own dollars to pay for those same services, substance abuse, mental health, those sort of things. And so as you see the human service dollars shrinking, you're going to see also a greater number of folks from that private sector needing public help. And so it's a really dangerous situation for most states and really for government right now, is that at the time that the very act of decreasing the availability is going to be increasing the need. And so where we have a pyramid type situation where if you do prevention to a broader range of people, the folks at the next level who would need a higher level of service should be decreasing. And then when you get to the very top of the most highest need, in that case, Bob's 23% of the families, to the very highest need, it's fewer families there that need that. And I think that what we're probably gonna create is more of I think it's called a Rambus or whatever, where it's not a pyramid, but it's gonna be a wider group of folks at the top of that pyramid who are at the top of that that are gonna need more services. And so all we're gonna do is just force the need to a higher level. And I think a good example of that is a lot of what I looked at in Springfield around saying DCFS should expand more and more services to more and more groups. And I'm not just talking about juvenile justice, but other groups as well. They should investigate kids who are between 18 and 21 in adult facilities, who have mental health needs that say they function as a child, and want to take that to ranges of 25 years old because the other areas didn't have enough investigators to do that and not enough dollars to invest. So as you see that, you're going to see a higher level of need. And so just reducing human services dollars, slashing and cutting human services is going to have devastating consequences, even for people who don't use public human services. But everybody uses human services, whether they're public or private.
We have time, I think, for one more question. And I think I'll go straight back here. Thank you, Ann.
I'm Ranjana Bhargav. I'm an independent person, but I've been executive director of 4 nonprofits. And my question to you right now is that, yes, the need is becoming greater. The triangle has shifted the other way now. But at the same time, when you talk about data, and this has happened concurrently in all my being director for mental health, for foster care, for battered women and for prisoners, that you give us the data and say, meet us at this point, provide us with the data. But when we go back to our workers and say we have to collect all of this, so many times it is just like a survey, they tick, and they really don't pay attention to what would be the needful presentation of what should be provided. And therefore, how do you train people who may not be at the master's level, may not be at the data level, whatever, to begin to say the value of data when they are at the grassroots level and providing just the service?
Thank you. I'm going to turn to Nancy first to talk about some lessons from the policing world that might be useful for human services, and then either Director McEwen or Tom may want to respond.
Well, I'll be brief because I think I made this point already. I think that if you can communicate to the people who are in charge of collecting the data that it has use to them, then they'll have a greater incentive to use it. So how do you do that? You help give them information that spans beyond their specific knowledge of their specific caseload that can inform how they do their work and how they can be more effective.
Tom, I think, already made the point of only collecting the data that really matter, really thinking about that in advance instead of saying, let's collect everything and then we'll figure that out later, which creates a different burden. So Tom, and then Director McEwen.
And I think that well, in terms of the question, I think it's a difficult challenge. The first is that collecting data which is not useful to the worker as they see it does all sorts of things. It breeds discontent, it breeds turnover, et cetera, et cetera, et cetera. And even though we've done a good job of stripping things away, there are things that my staff collect and they ask me why. Why are we doing that? And in some cases, I don't have the answer. But in other cases, I think that what we've done is we've talked about the difference that it makes in terms of a kid's life. Because at least with us, that is fundamentally why we're here. And it's not always easy, but I really do think it gets down to basic management and talking to staff about, why it's important that they document a case note. And then the thing that we're starting to drill into is the quality of the case note. Not necessarily that the case note exists, but what's going on in that interaction. And you're correct that folks bristle at it when you start getting into it, but I think that that's the only way to influence what's going on.
I think with the process you described for collecting data, I would find that cumbersome too. The data that we've been collecting is data that is the workers have to do anyway. So when you're talking about an integrated assessment, we have to do a front-end assessment anyway when that case comes in. And so we moved to an approach of doing a quality front-end assessment. Now, if you're doing a quality front-end assessment and you're entering all those things into computers, the requirement for state automated child welfare information systems are a federal requirement. We call it SACWIS. It's a federal requirement. So if you have the systems to input this data and you have to collect this data at integrated assessments, you have to do a service plan on these cases, you have to do some type of adolescence assessments or some type of assessments on the children, you have to do some type of assessments on the parents. And so it's thinking about data collection not in terms of collecting data for research, but the fact that we do collect data. Every worker collects data on every case every day. And it's talking about then taking that data and using that data for research purposes and not just inventing a data collection tool that they just have to use. And see, that's the challenges that we have. So because of the automation of information systems and the availability of technology, and most people are entering those assessments in required data anyway, then how do you start to use that as the information that you're going to feed back to the workers to talk about performance? So it's not about always creating a specific data collection tool for research.
Can I add?
Sure.
I think one of the other things that sometimes happens, and I've certainly seen this in my government experience and at Kaleidoscope, is that we sometimes create a new thing to count based on an event. You know, something bad happened, so we identify a variable to collect, which, you know, may or may not be relevant to collect, but trying to identify every single episode in a family's life or a child's life that might somehow surface and that we could count it, even if it's 1 in a million, becomes particularly annoying and cumbersome for staff. I think the other thing, and I ran Chicago Read Mental Health Center for a while, and one of the things that we talked about when I was there was that forms were the primary vehicle for collecting data. And that was in the mid-90s, and so there was still a lot of paper. Most of that stuff is electronic now. But the rule of thumb that we operated from was a sort of quasi-algebraic equation, and that was new forms equals the summation of old forms minus 1. And so you couldn't propose adding some data collection vehicle unless you got rid of one other thing, because oftentimes, and I think that the rest of the panel would support this, if you look at the vast array of vehicles that we use to collect data, at least in child welfare, there is a ton of duplication. And the great challenge for the computer guys is, how do I get that piece of information that I collected over here once so that it shows up over here for the worker and it's useful, so that they don't have to do a duplicate reentry, so it populates the screen. And it might sound easy, but I know that it's not. And if we do make progress, that would be a significant impact for folks. So.
Great point. Thank you. I'm afraid we're out of time. I want to thank several parties. One is the Urban Institute for their ongoing co-sponsorship of Thursday's Child. I believe this ends our 5th year of Thursday's Child events, so that's hard for me to believe. I want to thank the Chapin Hall communications staff for putting together today's event, and I want to thank the audience, both in the room as well as out in cyberspace, for taking the time to join us. And finally, I want to thank our panel for an engaging conversation.